Tomorrow morning, before you brush your teeth or pour your coffee, I want you to do one simple thing. Stand in front of your bathroom mirror, turn the light on, and really look at your own face for 30 seconds. Not to judge it, just to read it. Because your face, your eyes, your skin, your hair, even the front of your neck, can quietly tell you that one small gland in your throat has slipped out of balance long before you ever feel truly sick. Most people walk right past these signs for years, blaming them on age, on stress, on poor sleep. But once you know what to look for, they are sitting right there in the glass, waiting for you to notice. Today, I am going to show you 15 of them. I am Dr. Daniel Mercer. For more than 18 years, I have practiced internal medicine. And in that time, I have sat with thousands of patients over the age of 60 who felt that something was off, but could not put their finger on it. They were tired in a way that sleep did not fix. Their skin had changed. Their hair was thinning. And again, when we finally looked at the right gland, the answer had been showing on their face the whole time. The gland is the thyroid, a small butterfly-shaped gland low in the front of your neck. And the reason it matters so much is that it sets the speed of nearly every cell in your body. Before we go through the 15 signs, do me one small favor. If you find it helpful when a doctor explains these things slowly and in plain language, take a second to like this video and subscribe to the channel. It helps me reach more people your age who are walking around with these signs and have no idea what they mean. It costs you nothing, and it means a great deal. Now, let us begin. Let me explain what this gland actually does, because once you understand it, every one of these signs will make perfect sense. Your thyroid produces a hormone that acts like the thermostat for your entire body. Think of the thermostat on your wall at home. Turn it up, and the furnace runs warm and the house feels alive. Turn it down too far, and everything grows cold, slow, and sluggish. Your thyroid hormone works exactly the same way for your body. When the gland makes too little hormone, we call that an underactive thyroid, or hypothyroidism, and everything slows down. Your heart beats slower, your gut moves slower, your skin renews slower, and your hair grows slower. When the gland makes too much hormone, we call that an overactive thyroid, or hyperthyroidism, and everything speeds up and runs hot. Most of the signs in the mirror come from the underactive, slowed down side, because that is far more common as we get older, but I will show you the overactive signs too. Let me give you one more picture, because it helps people remember this. Imagine a delivery worker who carries a message to every house on the street, telling each home how fast to run. Your thyroid hormone is that worker, and the message goes to every cell you have. When the worker stops coming around often enough, the houses grow quiet and cold, the lights dim, and everything slows. When the worker comes far too often, the houses run hot and frantic and burn through their energy. Your face, your skin, and your hair are simply the front windows of those houses. Read the windows, and you can often tell what message the worker has been carrying. And here is why this matters so much after 60. Thyroid trouble becomes more common with age, especially in women. Among women aged 65 to 74, studies have found that roughly 16% have a thyroid level that has drifted above the normal range, and that number climbs even higher past 75. So if you are sitting there thinking this could not be you, please understand, this is one of the most common quiet imbalances in older adults, and it hides in plain sight. Let us read the mirror together. Sign number 1 is a puffy, swollen face, especially around the eyes. When the thyroid slows down, a kind of jelly-like substance builds up under the skin and traps water. Doctors have a name for this, but you do not need it. What you need to know is that it gives the face a soft, puffy, swollen look, and it shows up most around the eyelids and under the eyes. Patients tell me, my face looks fuller and I have not gained weight, or my eyes look heavy and tired no matter how much I sleep. If your reflection looks puffier than it used to, and it is not from salt or a bad night, make a note of it. Sign number 2 is dry, rough, flaky skin. This is one of the most common signs of all. When the thyroid slows, your skin renews itself far more slowly, so dead cells pile up on the surface, and the skin turns dry, coarse, and scaly. You will feel it on your face, your forearms, your shins, your elbows. Lotion helps for an hour, and then it is dry again. In one study of hypothyroid patients, more than half had this kind of stubborn dryness. So if your skin has become like sandpaper and nothing seems to fix it, the cause may not be in the bottle of cream. It may be in your neck. Sign number 3 is thinning eyebrows. And here is a very specific clue. Look at the outer third of your eyebrows, the part nearest your ears. In thyroid trouble, that outer edge can thin out or disappear, while the inner part stays. Doctors actually use this as a visual clue during an exam because it is so telling. If you have noticed you are penciling in the ends of your brows where hair used to be, look closely. That outer third thinning is worth paying attention to. Sign number 4 is thinning. Brittle hair on your head. A slow thyroid slows the growth of hair all over the body. The hair on your scalp can become thin, dry, coarse, and brittle, and you may notice more of it on your pillow, your brush, or the shower drain. Nearly half of patients in studies had this kind of diffuse thinning. This is not the patchy bald spots of other conditions. It is an all-over thinning, where your hair simply feels like there is less of it than there used to be. Sign number 5 is pale or slightly yellow-tinged skin. When circulation slows down with an underactive thyroid, the skin can lose its healthy color and look pale. And in some people, the skin, especially on the palms and soles, takes on a faint yellow or orange tint, because the body is slower to process a pigment that comes from certain foods. So if friends say you look pale or washed out lately, your reflection may be telling you something real. Sign number 6 is a dull, tired, flat facial expression. This one is harder to describe, but patients and their families notice it. The face can take on a heavy, slowed look. The eyelids droop a little. The expression seems flat or tired, even when you feel emotionally fine inside. Loved ones will say, "You just look exhausted lately," and you are not sure why, because you have been sleeping. That slowed, heavy look in the mirror is the thyroid setting the pace of your whole face. Sign number 7 brings us to the neck itself, and this is the most important one to look at directly. Stand at your mirror, tip your head back just slightly, and look at the lower front of your neck, just below your Adam's apple. Then take a sip of water and swallow, and watch that area as you swallow. You are looking for any swelling, fullness, or a lump that moves up and down when you swallow. An enlarged thyroid is called a goiter, and it can make the base of your neck look swollen or full. If you see a bulge there, or feel a fullness, that is a sign to have your doctor examine your neck. Sign number 8 is swelling or puffiness around the eyes that I want to separate from general face puffiness, because it can point either way. On the underactive side, the eyelids and the area around the eyes look puffy and heavy, but on the overactive side, you may see something different, and that brings us to the next sign. Sign number 9 is bulging or staring eyes, and this points to the overactive, sped-up thyroid. In a condition where the thyroid becomes overactive, the tissue behind the eyes can swell and push the eyes forward, so they look like they are bulging or staring. You might notice you can see more of the white of the eye than before, or that your eyes look wide and prominent in photos. If your reflection has developed that wide, staring, pushed forward look, that is a sign that deserves a doctor's eye. Sign number 10 is a flushed, sweaty, overheated look. The overactive thyroid runs the body hot, so instead of the pale, dry, cool skin of the slow side, you may see warm, flushed, slightly sweaty skin, even in a cool room. Patients say, "I am always too hot now. I am throwing off the covers at night while everyone else is cold." If your face looks flushed and damp when it has no reason to, that is the fast side of the thyroid showing itself. Sign number 11 is changes in your weight that show in your face and body without a change in how you eat. The slow thyroid tends to bring gradual weight gain and a fuller, rounder look, even when your eating has not changed. The fast thyroid can do the opposite, bringing weight loss and a thinner, more drawn face, even when you are eating the same or more. So if the mirror shows a clear change in your size and you have not changed a thing about your meals, your thyroid may be the hand on the dial. Sign number 12 is brittle, ridged, slow-growing nails. Lean in and look at your fingernails. A slow thyroid can make the nails dry, brittle, and prone to splitting and cracking, with ridges running along them, and they grow more slowly than before. The same hormone that slows your hair and skin slows your nails too. If your nails have turned weak and ridged and you cannot explain why, add it to the list. Sign number 13 is dry, cracked lips and the corners of the mouth. Because the slow thyroid dries out the skin all over, the lips can become chronically dry and chapped, and the corners of the mouth can crack, no matter how much balm you use. It is a small thing, but combined with the other signs in the glass, it adds to the picture. Sign number 14 is a hoarse or deeper voice. This one you hear as much as see, but it shows at the mirror when you talk. The same fluid buildup that puffs the face can affect the vocal cords, giving the voice a hoarse, rough, or deeper quality that comes on slowly. If people keep asking whether you have a cold when you feel fine, or your own voice sounds lower and rougher to you, the thyroid can be the reason. Sign number 15 is swelling and puffiness beyond the face that you can catch in a full-length mirror. Look at your hands and your feet and your ankles. The slow thyroid can cause a general puffiness, so the hands look swollen, the fingers feel thick, and rings feel tight. The ankles can look puffy too. When you put the puffy face, the dry skin, the thinning brows, and the swollen hands together in one reflection, the picture becomes hard to ignore. Now let me tell you about one of my patients, because she is the reason I take these mirror signs so seriously. I will call her Eleanor. She was 66, and she came to me certain that she was simply getting old too fast. She was exhausted all the time. Her skin had gone dry and rough, the ends of her eyebrows had thinned away, her face looked puffy in every photo, and her voice had taken on a hoarse edge that her grandchildren teased her about. 3 different times she had told herself it was just age and stress. When she finally sat in my office and I looked at her face, I could read the story before we ever drew a drop of blood. We checked a simple thyroid blood test, and sure enough, her thyroid had slowed down. With the right care from her doctor, over the following months, her energy came back, her skin softened, and the woman in her mirror started to look like herself again. The signs had been there for years, she just had not known they were a message. So what do you do if you have looked in the mirror and recognized 2, 3, or more of these signs in yourself? Here is the most important thing I will say today. These signs are a reason to get tested, not a reason to panic, and certainly not a reason to diagnose yourself. Many of these signs can come from other ordinary things: dry winter air, aging skin, certain medications. The mirror cannot tell you for certain what is happening. Only a simple blood test can. That blood test is easy, and you should know its name so you can ask for it. The main test is called a TSH test, which checks the hormone that controls your thyroid, and your doctor may add a couple of related thyroid levels. It is a routine blood draw, nothing more. If you are over 60, and especially if you are a woman over 60, this is a very reasonable thing to ask your doctor about, because major thyroid groups suggest that doctors consider checking thyroid levels in adults past 60, given how common it becomes. So bring this list to your next appointment, tell your doctor which signs you have noticed in the mirror, and ask, plainly, could we check my thyroid? One more thing about that test, because patients ask me this all the time. You do not need to feel dramatically ill to have it done. In fact, the whole point of reading these signs early is to catch a slow drift long before it ever knocks you flat. A thyroid that has only gently slowed can still leave its fingerprints on your skin and your hair while you are still walking around, gardening, and living your normal life. That is exactly the moment you want to find it, while it is small and easy to manage with your doctor, not years later. So do not talk yourself out of asking just because you can still get through your day. The mirror is showing you the early chapter, and the early chapter is the best place to step in. Let me give you a few words of safety and caution, because I always want to be honest with you. Please do not look in the mirror, count up signs, and decide on your own that you have a thyroid problem and start taking anything for it. Thyroid conditions must be diagnosed with a blood test and managed by your own doctor, because the treatment has to be matched carefully to your body, your age, and your other conditions. And please, never stop or change any medication you are already taking on your own. If anything in the mirror has appeared suddenly, or if you ever have real trouble swallowing or breathing because of swelling in your neck, do not wait for a routine visit. Contact your doctor promptly. The mirror is a wonderful early warning tool. It is not a substitute for your doctor. Here is a simple habit that turns all of this into something you will actually use. Once a month, on the first of the month, do a 30-second mirror check in good light. Look at your face for puffiness, your skin for dryness, the outer ends of your eyebrows, the front of your neck as you swallow a sip of water, and your hands for swelling. Tie it to a date you already remember, the first of the month, so you never have to think about it. And here is a small bonus that makes it even more powerful. Snap a clear photo of your face and your neck every few months and keep them in your phone. Slow changes are nearly invisible day to day, but when you compare a photo from 6 months ago to today, a puffy face or a fuller neck jumps right out at you. Your phone becomes a second, patient set of eyes. Let me bring this all together. Your thyroid is a small gland in your neck that sets the speed of your whole body, and when it drifts out of balance, it leaves clues on your face, your skin, your hair, your eyes, your nails, and your neck. We walked through 15 of them, from the puffy face and dry skin and thinning outer eyebrows of the slow thyroid to the bulging eyes and flushed, overheated look of the fast one. None of these signs alone proves anything, but 2 or 3 of them together are your body asking you gently to get one simple blood test. So look in the mirror with kind, curious eyes, notice what it is telling you, and then take that information to your doctor, where it belongs. If this helped you see yourself a little more clearly today, please subscribe and stay with us. This channel exists to help you read your own body and stay strong, sharp, and independent well past 60. I am grateful to walk through it with you. Take good care of yourself, and I will see you in the next one. One last and important note. This video is for general educational and informational purposes only, and it is not medical advice. The signs we discussed can have many causes, and only a qualified healthcare provider can tell you what is truly going on. Please speak with your own doctor before making any changes to your care or your medications, and let them examine you and order the right tests. Your doctor knows your body, so bring this to them and let them help you use it well.